My name's Dr Christina Ekegren and I'm a Senior Research Fellow in the Rehabilitation, Ageing and Independent Living Research Centre in the School of Primary and Allied Healthcare at Monash University. I also work at the School of Public Health and Preventive Medicine, and I have affiliations with the Alfred Emergency and Trauma Centre and the Baker Heart and Diabetes Institute, and I'm also a physiotherapist by background. My research is mainly focused on healthy ageing via physical activity promotion, and I do this mainly with clinical populations rather than healthy older adults that live in the community. Clinical populations in clinical settings. A couple of years ago, I got involved with the End PJ Paralysis social movement, which is basically a global campaign aiming to get hospitalised patients out of their PJs and out of bed and then out of hospital, and particularly older adults who are in hospital. And as part of this work, I started working with the staff at Caulfield Hospital who wanted to implement this intervention into their geriatric evaluation and management wards. And before we started, we decided that we would measure how active patients actually were on the wards. So we fitted patients with this little device known as an Active Pal, and we monitored and measured their activity levels for a week or so. Patients were so sedentary that we were barely detecting any movement or activity at all. So the majority of patients were sitting down or lying in bed 97% of the day, and they were only taking around 400 steps per day. And when you consider that those patients were there to recover and return to the community, you can see how being that inactive could lead to really significant deconditioning and could actually lead to patients going backwards. So I guess it was a breakthrough in that we really saw what a big problem it was and how important it was that we had to address it. My research, it's always a work in progress. It's a really complex problem trying to improve health services for older adults. It comes down to the design of healthcare systems and wards. It comes down to funding. It's even culture of patients and staff and families that you're trying to change. You know, if we see even small changes, I think it'll make big improvements in the lives of older adults. So, you know, I think that that's how I'm trying to change people's lives for the better. Now I work at a new research centre, Rehab, Ageing and Independent Living, and that's supported by Monash University. And so I feel very lucky to be part of this new centre from the outset as we start to grow the research centre. So I'm very grateful to Monash for that and all of the work that's come before that.